to travel, journey, voyage, expedition, tour, pilgrimage, safari, odyssey, to boldly go where no one has gone before.
Welcome to our podcast, Travel Unraveled, an ISTM podcast sponsored by the International Society of Travel Medicine and IMAT, the International Association for Medical Assistance to Travelers. Today's episode, we have some very exciting guests and some mentors, and I would have to say some huge names in the field that have done a lot for travel and tropical medicine. It is a very great honor to introduce Dr. David Freedman and Dr. Dipti Patel. And of course, we have Anne and Albie. Albie, you've been away for so long.
I'm sort of back. I'm back, but I'm in the bush, which is why my background's a bit different. And I've just been joined by a co-director in the form of a little vervet monkey. So if I suddenly shout or scream or use obscenities, that's why.
Well, I hope it says hello for us.
So David Freedman is co-founder of GeoSentinel. And as you said, Aisha, somebody that we've all known for a long time. David's been at the forefront of especially GeoSentinel and the establishment of an amazing worldwide network to really help us with respect to trying to keep travelers healthy. He's professor emeritus of infectious disease at the University of Alabama.
He has been responsible for the education of almost 1,000 what we call Gorgas graduates. And for those of you who don't know, the Gorgas Tropical Institute is the gold standard in tropical medicine.
Many Gorgas graduates have gone on to be GeoSentinel sites because they come to Peru, and if we like them and if we, think they're, pretty good, then after the course, we invited them eventually over the years to be GeoSentinel sites. So actually very interconnected.
Albie, do you want to introduce Dipti?
I've known Dipti for many years, but I don't have the formal version, seeing that I've been out in the bush and I'm out in the bush without my notes. So you go ahead, Anne.
Dipti, OBE, Director of NaTHNaC, UK's National Travel Health Network and Centre, and Chief Medical Officer for Foreign, Commonwealth and Developmental Office, also part of the UK government. And Dipti's also been involved in GeoSentinel, but we've brought her here today to talk to us about what NaTHNaC does so that we can compare on either side of the pond some of the stuff that goes on.
And on that note, what this episode is talking about is how do sentinels or travelers as sentinels work to prevent the spread of disease? And how can travelers themselves act as sentinels? Dr. Freedman, Dr. Patel, we'd love to hear from you about a little bit of what your organizations were set up to do and what they are doing and some examples.
Yeah, so at NaTHNaC, we are a public health aid body commissioned by UK equivalent of the CDC, UK Health Security Agency. To our broad remit is to protect the health of British travellers. So we don't have any direct relationship with travellers. We don't see travellers, but we provide public health advice or travel health advice to travellers and those informing travellers or advising travellers, so health professionals. And we do this in a variety of ways, but probably of most relevance to this lecture, this podcast, is our website, which has a wealth of information on what travellers should do before they travel. Our website's called Travel Health Pro, including sort of advice on what vaccinations or malaria prophylaxis you might need if you're going to particular destinations. But we also have a special bit to our website, which is our outbreak surveillance database. And those are probably the two most relevant bits in terms of traveller surveillance. Our information on our website is informed by a number of sources, but one of the things that we do inform, our data is informed by, is this traveller data. And that's in two separate areas. So in terms of our country recommendations, we have return traveller data from a number of sources that we use to help inform our vaccination recommendations, but we also in the UK do enhanced surveillance for 2 separate types of diseases. So malaria, we have an enhanced surveillance system for malaria, and we have an enhanced system for enteric fevers. And with both of those, with the enhanced surveillance, we're actually able to really get a good idea of what the risks are to travellers, UK travellers going to certain parts of the world, and what the challenges are in those groups. So a good example would be for typhoid. We know that most of our return travellers with typhoid are travelling to South Asia. So we know that that's a group that we want to particularly target in terms of our advice. And they tend to be individuals that have got historical links with South Asia, maybe visiting friends and relatives in that area. So again, we know the type of travellers that might be at greater risk of typhoid. Similarly, with malaria, we have good knowledge of the sort of where most of our traveller cases are coming from. And it helps us inform our chemoprophylaxis advice as well. So we know, again, like many parts of the world, West Africa tends to be a particular problematic place. And we certainly have a big number of travellers going to that part of the world. And we also know it's, again, those travellers that have historical links with those countries in West Africa, visiting friends and relatives that are increased risk. So we use that data to inform our travel advice, but also be very specific about the type of people. And in some parts of our malaria data, we can also be specific about regions that we think are particularly at risk because we have very good data on where the traveller has been. So that's our enhanced surveillance activities. We also get reports from, because the UK has a nationalised health service, our data is available to us through a variety of sources, so we can get it through the NHS. But we have a rare and imported pathogens laboratory, which basically gets all the investigations for tropical diseases. And so they're able to look at the data and actually give a heads up to us about any unusual trends that they see. And a good example of that was in 2014. Early 2014, they noticed a 12-fold increase in the number of cases of chikungunya they were getting from travellers going to the Caribbean. Now, chikungunya is a mosquito-borne disease. And because they were able to collect all the data from all over the UK, they were able to notice the trend. If it had been 1 or 2 cases, maybe the trend might have been missed. And as a result of that, we were able to change our travel advice related to that, work with UK government on making sure messaging got out to travellers going to the Caribbean. And actually that made the national press as well, which meant the message was getting out further. And certainly for us, again, we have great sort of historical links to the Caribbean. We have a number of individuals that have family living in the Caribbean. So not only for leisure traveller, but again, for VFR travellers, it's a really important part of the world for us.
For those cases of chikungunya, what sort of advice did that information help you to give the future travelers? Because obviously the advice we do not want, or the message we do not want, is don't travel. It's how to mitigate the risk and be able to enjoy that particular place. So what sort of stuff did you guys talk about?
Yeah, so again, yes, absolutely. Our role is to try and enable travel if we can. Obviously, there may be some situations where policymakers may choose to stop travel, but that will be very rare for health reasons. So our advice was very much around prevention of mosquito bites, measures that the traveller could take, but also disseminating it in a way that we know that not everyone will come to our website, but we certainly know that travel health professionals do. So making sure they had the right information to inform the travellers they were seeing, but also working with community groups that might have inroads to those particular communities that might not look at our website. So and actually for us, I think getting it into the national press was a big thing, because that then everyone's talking about it.
And I think it's important what you talked about. It's not only the traveler themselves that might come back and be ill, but it's the organism as well that we really need to identify and figure out how we can keep other people from getting it or treat them quickly if that's appropriate.
So Albie and Dipti, you guys both have said you guys know each other for a very, very long time, but then you kind of left it at that very mysteriously. So I'd like to know, did work and this basically these types of outbreaks bring you guys together in this realm, or what's the history between you guys in regards to outbreaks or surveillance?
I went to the South Africa conference in Cape Town, and that's
I was at that one too. I was there too.
I presented my dissertation there.
in October, there's another conference, not quite in Cape Town, but in the winelands just outside in Stellenbosch. You're all very, very, very welcome. Because I think we're talking about networks, and we're talking about the value of GeoSentinel, for example. And I think one of the biggest things about something like GeoSentinel and ISTM as part of that is the international networking and the opportunity to be able to drop an email, or even better these days, send a WhatsApp and have a conversation with somebody to say, I've got a special traveler going under very specific circumstances. They can't take this malaria prophylaxis, that one and the other one. What is the malaria situation really like right now? Because it actually matters for this individual. And that's a wonderful thing that stems from these networks. And I think in a world where things are sort of going nationalist and we're putting up borders and fences and stuff, I think we've almost got a bit of a mission in GeoSentinel and in ISTM to maintain these academic and friendly links to the benefit of all travelers.
I think that's a very important point. And the other thing is, it does allow us to bypass some of the formality. Like sometimes officially people can't make a stand and say something, but we can have a hall room sort of conversation about it. So David, do you have a story or an example?
Let me mention a little bit about what a sentinel is, and a little bit about GeoSentinel. So, I mean, from I think the public health perspective, the meaning of the word sentinel is sort of the canary in the coal mine concept. We don't send them out, but the travelers send themselves out to sample the environment in 240 countries around the world. And the point is that tropical medicine clinics, if they do become ill when they travel, when they get home, we can gather information on them at relatively few points of contact, because they will go to these very specialized tropical disease clinics that exist in most countries. So if you can monitor the data there, you can monitor disease really on the front lines at the point of entry into domestic populations. So, and really the clinician is often the first point of contact. The advantage it offers over traditional public health and public health laboratories is you can use expert clinicians to detect something funny that's going on, a syndrome that doesn't quite fit, or a possible disease from a country, where that disease, either has not been described or has not been, if you see, 2 or 3 patients with the same thing, there's coming from the same country where they visited or originated from, that something might be going on there. And then if you can aggregate that information, certainly if more than one location, say one in the US and one in the UK, starts seeing more than one patient with the same disease, it may take a few days to get the laboratory confirmation from a specialized lab, or it may be a few days once you get the lab result to report it to public health, or the laboratory does report it to public health, but there's an inherent delay of several days. Meanwhile, it is, in some cases, it's just a matter of getting out the education. In some cases, it's a matter of some kind of intervention getting started as soon as possible. So that's the point behind GeoSentinel, which started in 1995, really. Took a few years to really start collecting data, but it really started with some conversations between myself and Phyllis Kozarski and Marty Setrin. We lived close to each other. Phyllis is at Emory, and Marty it was at CDC, and I was in Birmingham, which is just a 2-hour drive away. And it was kind of Marty's germ of an idea, and they brought me in quite quickly because, like Aisha kind of does now with ISTM. At the time, I was in charge of what was called the Electronic Communications Committee of the ISTM, and actually, I actually started the discussion group ProMED, which was a listserv at the time. I was responsible for the website at the time, so I was known as somebody that could do this electronic communication.
So we've got people faxing you from around the world. Like, can you explain about the actual network, and what the GeoSentinel looks like?
Yeah, so when we started off with the pilot data, it was only about 8 sites, and of course, I'd be remiss without mentioning some familiar names. I mean, we started off with the best of the best. So, it was Phyllis's clinic in Atlanta, Jay Keystone in Toronto, Brad Connor in New York, the Hospital for Tropical Diseases at London, and we actually started off. Charlie Eastman was a trainee at the Hospital for Tropical Diseases, and he was the only one that was interested in the beginning, and he was a tremendous help, as I'll tell you shortly about the Borneo Eco Challenge. So and Murray Whitner, another one in New York, Murray Whitner in New York, Elaine Zhang in Seattle. Those were the original sites. So and now I was a director for 18 years, and then up until 2013, and at the time there were about 70 sites contributing data, representing every continent. So at the time, what was happening was people would fax it to Atlanta, and we actually had a real person and a real database. So we actually had data managers who would take the faxes off the machine, try to interpret them, and enter them into a standard, Microsoft Access database. And as I said, when the web application came along, it obviously became more automated. The strength of GeoSentinel is not just to be able to detect Sentinel events, it's also to look at trends. I mean, the idea is that people are the core sites are entering data on an ongoing basis. So it's not just a matter of discussing discovering new pathogens. It's a matter of looking at the trends over time in things that we know exist, but there are outbreaks and increases in particular diseases in each country.
Can you give us some examples of specific, either a specific sentinel or signal or a trend? And maybe both of you can give examples from your organization.
Okay. So the Borneo, so interestingly, this all broke on a very famous date, September 11th, 2000. So exactly 1 year before the more famous September 11th. So what happened was I arrived at work one morning, and there was an email from Charlie Eastman, actually, in London, who said, I have these 4 people that just all got back from Borneo. They're sick, they have symptoms, it's compatible with leptospirosis, but we're waiting for lab results to come back. Have you heard of any other sites having this problem, or can you query, and this is the key thing here, the query, can you rapidly canvass the other sites and see if anything's going on? Because the problem here is that these 4 people were just back from Borneo, and they were in this adventure race called the Eco Challenge, and they did all these different sports and had all these different kinds of exposure, and including a very long swim in this very polluted looking river. The first thing we did was informal, and we emailed just a couple of people in big cities. Anyways, Jay Keystone in Toronto wrote back and said, hey, I have another few that are just like this. Anyways, with a lot of, we worked it out. We worked it out with CDC at the time, and we decided the fastest thing. We had a very carefully worded email. You have to be a little careful if you do something public, to really put it out on public airwaves, you have to be careful with the wording because, you may offend, Borneo or the local public health authorities there, et cetera. So we worded it quite carefully. We sent it internally just to our sites by email. And then we got back. I'm just going through kind of a sequence of events here. And then we got back, without going into specifics, several other sites we're seeing, locations we're seeing around the world, we're seeing the same thing, and it amounted to about 13 or 15 cases. Then we looked at the timeline, and we decided it was time to go public. And this is where, what good do you do, or what good to these, kinds of things do? Then we looked at the timeline, and we realized that this wasn't just a point source, because this was the type of multi-day adventure race where the last participant finished the race like 8 days after the first participant, and that some people, and then everybody immediately went home after the race, so that there were some participants that finished, at the end of the race, who were still within the incubation period for leptospirosis, where possibly some antibiotic therapy would do some good and prevent them, from getting clinical disease. So at that time, we decided to go to ProMED-mail, which is a bulletin board that's read by health people and public health and all kinds of people interested in these diseases around the world. And we put it out on ProMED-mail. And, again, the technology is a lot better today. But again, remember, this was 25 years ago. This all took a grand total at the time of 14 hours. And I had arrived at my office at 7:45 in the morning as usual, and I was still still working at midnight when we sent this out to ProMED-mail. And because of our these are personal relations. Because of our personal relations, I knew Jack Woodall, who ran ProMED-mail, very, very well. So I called Jack and gave him a heads up, and I said, it's midnight. This is coming into ProMed, but can you guys jump on it and and get it out there first thing in the morning? And they did.
And just for those who don't know what ProMed is, just a quick line about basically it's is it directly from the CDC? Correct me?
No. It was started, and then it was started by Jack Woodall as an independent thing, and then it was taken over by the International Society of Infectious Diseases.
It's basically just an email surveillance of diseases.
It's a similar type of Sentinel network. So people can send in their Sentinel events or their upticks in trends or whatever they want that they're worried about. It is moderated. They have editors, experts that filter the information. And then similarly, they started off as a listserv. It was an email service. You subscribed and you got these emails. And then, in early 2000, it became a website. So they collated, all the postings onto a website, and you could visit every day, although you could still get, feeds from it. And, it also became a very rapid and, hundreds of thousands of subscribers. All
interesting
over
how it's all connected, right? And you guys are all connected through all of them. So that's fantastic.
Yeah. I think that the example of Borneo is really important, as you said, David, because you saw a signal, quickly investigated, very quickly communicated and disseminated that information, and actually prevented disease that could be quite serious. The other big advantage, I think, of GeoSentinel is also allowing, as you said, constructively, the local population or the local public health and health authorities to know what's going on in their communities, because a lot of times these are in areas where maybe they don't have the ability for that surveillance or to make a definitive diagnosis, so that if they have people locally with an outbreak, at least they know what to use for therapy instead of wasting very important resources. So I think there's a lot of contribution that GeoSentinel has beyond the public health and the traveler as well, or potential for that.
Yeah.
And I think what NaTHNaC does as well is very much similar to that. Like, it congregates that information and it creates information to inform the public, right, and the travelers as well as to what's been going on. Dipti, can you speak to that a little bit about how that may differ a little bit from the GeoSentinel, or maybe an example?
So as I said, at NaTHNaC, we don't see patients directly, but obviously we get that information. I think the key that the couple of things that David said that really sort of struck me is the timeliness of the information is really important. Sometimes when you're waiting for public health systems, it takes a little while to go through official channels. Having said that, we're quite lucky at NaTHNaC. We've got this relationship where we can put sort of real-time information out. We don't always have to go through, we obviously have to make sure it's validated, etc., but we don't have the bureaucracy that some public health agencies have in disseminating that. The other thing is about validating that information, which is where the network is really important. So again, if we get something that we're not sure about but it looks unusual, we will usually try to, we work very closely, as I said, with UKHSA, and through our national international health regulations focal point, we will try and get more information or liaise with that country, their Ministry of Health, to understand what's going on. So, and actually sometimes it's helpful to them. They will ask us for more guidance, or if we've picked up at something in a traveller that they weren't aware of. And sometimes they'll validate that information for us. It can be a bit slower. And what David said about making sure you don't upset local public health authorities is really, really important, because, and I think, I don't know what GeoSentinel experienced during Zika, but certainly I know we used to get petitions a lot during Zika in sort of 2015, 2016 to change our guidance because it was affecting travel. Yeah.
And you picked up some recent Zika cases as well, Dipti, correct?
Yeah, so actually, it also, I mean, of course, it's Sentinel surveillance will give us information about new things that are happening, but also it's a reminder that there are things still going on that people might have forgotten about. And Zika is a good example. We obviously, through our laboratories, again, we get information on cases of Zika in return travellers, and we had our first case of congenital Zika syndrome in a return traveller from Thailand. We certainly have Thailand as a risk country, and Thailand had been experiencing an outbreak in certain parts, but the thing is that people had forgotten about Zika. It was a disease that people think happens in the Americas, and it's just a reminder when you see these cases that actually the risk is still there. People have just forgotten about it, or it's not prominent in the headlines anymore.
I remember a couple of years ago, I can't remember the exact date, but again, the importance of making known Sentinel cases, and it did involve GeoSentinel, but we actually saw all of the cases here. So we all know that there's East and West African trypanosomiasis, and the biggest killer of travelers in Africa is malaria, but not every fever is malaria, and these cases demonstrated so nicely, but also sadly in a way, in that the first person that came to our attention in Johannesburg was a young Brit who was a nature conservationist in the north of Malawi, and he contracted a febrile illness and ended up getting treated for malaria for 2 weeks. And by the time he was medevaced to South Africa, he was basically moribund from what proved to be East African trypanosomiasis, and
or sleeping sickness for those of you who don't know.
African sleeping sickness, and within days to weeks, we picked up more cases from neighboring Zambia and from Malawi, and the first guy died, but the next 3 people, it was like, hey, we haven't heard of sleeping sickness for years in this part of the world, but suddenly here it was, and it all presented in travelers. And interesting, the one guy that presented in Zambia was an ex-South African living in Australia, who was on holiday in Zambia when he got sick in a game lodge. And there was a South African doctor who said, hang on, is this just malaria? This nasty lesion you've got on your leg might be something else, and contacted infectious disease guys in Joburg. So the importance, Dipti, you just highlighting again, Zika hasn't gone away. Here's a real case. I recently had somebody from the Netherlands contacting me about a pregnant daughter-in-law, and, should they come to South Africa, or should they go there, or should they go there? And they were concerned about Zika. And one tends to say, well, Zika, yes, it's around, but it's a low risk. But cases like yours just highlighted again how important it is because that's what also gets the message across to the public. And at the end of the day, that's what we want to do. I've got
And
one other little remark to make, because I live on the African continent where public health isn't always a very strong point. And very often people see travel clinics as medical institutions taking care of rich people with 4x4 vehicles going on safari. And when I teach travel medicine, I often say, I've got a picture from the WHO on measles outbreak in the Democratic Republic of Congo. And I'm saying, why would we be interested as travel health practitioners to know that there's a measles outbreak in the Congo? Well, that's because I'm going to tell my traveler to the Congo, my mine worker, be sure you either have had measles or you've been vaccinated. But the reverse of that is equally true. If I see a traveler coming back from somewhere where we haven't heard that that particular disease is actually prevalent at that point in time, we can aid public health as well. So it's not two things that stand apart. It's not the rich and the poor and the masses and the individual. We're actually on the same planet. I recently had the privilege of spending about a week in an East African country. I won't mention it, but we go back to the problem of formally declaring public health threats, and that governments are sometimes reluctant to do that. I asked a laboratory worker in a remote mine site whether they ever saw dengue, because if you go and look at the CDC website or NaTHNaC or whatever, oh, there's dengue in Tanzania. Well, you do lots of rapid tests, you see lots of fevers. Do you ever see dengue? And her answer was, I'd rather not answer that question. And when I asked the mine doctor afterwards, why was the laboratory worker not prepared to answer the question? He said, oh, no, it's a reportable disease here, and she's concerned that she may get into trouble. That's rather sad. But that's the reality of many parts of the world where something like GeoSentinel plays a huge role in creating awareness of diseases that are not only threats to travelers, but actually to the local population as well.
I think it's a really important point. And I think all of you have highlighted these examples where it's actually been a traveler that's carried a specific organism to another part of the world, and that's where it's been detected. And I think that's what we wanted to really highlight, is the role of travelers as these sentinels or, vehicles to carry disease. And of course, we saw this very widespread with COVID, right? Because COVID really started as a travel disease. And so I think this is really important. And, based on this, what would you, David, Dipti, and Albie, what would you say would be your take-home messages to our travelers in regards to, understanding that potential role that they may play in this?
If I can just make a comment, I think what you said is very important. It's travelers and the diseases they may pick up. But I think it's really important for people to understand the vast, vast majority of those diseases are actually no risk for the people at home. So you're right, things like influenza goes around the world, flu goes around the world very easily by travelers and other beings. And SARS was an example, and COVID was an example of where travelers brought something home and it spread. But the vast majority of things are a problem for that individual and fellow travelers, but not really for the rest of the people in the community. So I think that's important for whether you're traveling for vacation, to visit friends and relatives, for migration, whatever you're traveling for, you're not really a big risk for others. Dipti, you wanted to say something?
Yeah, and I was going to say, to add to that, we've got to remember there is a bigger public health issue as well, because travellers can be a vector to import disease into a country where a disease doesn't exist. And we think about things like yellow fever, think about polio. So it's again reminding that actually that traveller can actually create a problem potentially for the country they might be travelling to. And we've seen that obviously with yellow fever happening in parts of Africa as a result of workers not being vaccinated and traveling to another part of Africa and resulting in onward transmission.
In terms of the, bottom line take home, I think just, for those that haven't heard it before regularly, if you're a traveler and you've been on a trip in the past couple of months and you're not feeling well, tell your doctor. not only that you've traveled, but exactly where, and be prepared to give a day-to-day itinerary, because even within a destination country, disease can vary as to location. And if you're a clinician, ask every patient, no matter what they have, presentation wise, if they've traveled. Now, this has become more common. This has become more common since it actually started with Ebola, because that question got added to every intake history during Ebola, and actually lasted the specific question, like, have you been in West Africa? I mean, when I went to the doctor, I mean, that was in 2014, and I think it was about 3 or 4 years later, I was still being asked every time I went to see the doctor at our hospital. The nurse asked, have you been in West Africa in the past 30 days? But it's still an important intake question, and clinicians should also get their particular practice to incorporate it as a standard question for all ill patients that present. And for travelers, what this allows your doctor to do is to make 2 lists in their mind. What could this presentation, doctors are rushed these days, unfortunately, in all countries, in all healthcare systems, and you've really got to make decisions about how you're going to take the discussion and how you're going to order the test very, very quickly. And what the clinicians need to do is make 2 lists. One, if this is just any other patient sitting in front of me. 2, what about the travel history, because it's a different list that you might want to have to think about and order tests for.
David, and maybe to add to that is, when the patient sits in front of you, the question is, what might kill the patient, what may kill me, and what might kill all of us. That's
very good.
Quite an interest. That's an important distinction to make. And that's where never treat a traveler with disdain. You never know what he could be up to.
I don't know how to follow that, but
I think that's a good.
Yeah, I think we might have to end with that. I was just going to say that I think, like David said, it is if you're feeling unwell, you must get medical attention and really make sure that the health professional you see is aware of your travel history. And I think, it's going back to what David said. I remember at medical school, we were always told to ask about travel history, but I wonder how many people ask that question now. And I think the other thing I would just say is, from a health professional perspective, is that early communication of something unusual that's going on, because it is really about getting that information in a timely manner.
The other thing is, I think sometimes, like if we think back to COVID, where emergency rooms were saying, don't show up if you have a fever and you've traveled, there were cases of malaria and other things that didn't get diagnosed. People got sicker because of that. So I think, as people who deal more with travelers and tropical diseases, we have to try and get that message out as well through our different networks when instances like that happen.
On that note, I look forward to seeing some of the surveillance reports from where you are, Albie. I also just wanted to say that we from Travel Unraveled at ISTM Podcast wish you a very, very happy birthday tomorrow. And look at them smiling. There we go.
Whose birthday is that?
It's your birthday.
Are you 29 again, Albie? 29?
25.
Oh,
Only
25 for life. 25 for life.
You were not 5 when I first met you, so I'm sorry.
Well, thank you so much. This has been really informative, and I think it gives really a good sense to our listeners about the work and the people behind a lot of these disease outbreak and presentations that we hear about and that we see about and that we need to be informed about. And thank you so much for all the incredible work and dedication that you all have put into your lives, for the last so many years, to create these incredible networks that really have, saved a lot of lives and really prevented a lot of disease progression. And so, on that note, I also just wanted to thank our sponsor, International Association for Medical Assistance to Travelers, as well as the International Society for Travel Medicine. If you want to hear more stories, I believe, Dr. Freedman, you have a book there you wanted to show us.
Yeah, for
to show
this
us.
this is from 2007, so only goes through the early eras of travel medicine, but it's available. It's called Travel Medicine: Tales Behind the Science. It's from Elsevier. I'm not sure whether you can still buy it, but I think it's available on Google Books. Is that what somebody told me? Yeah.
It is
So,
available as a link, and we'll put it as a link after as an extra resource on the ISTM website. So it'll be located at learning.istm.org/podcast, as well as other fun clips. Maybe we can get a video of Albie and his vervet monkeys where he is there. But other extra resources, links to GeoSentinel, links to NaTHNaC, and other resources that you can use as our listener. That was fantastic. Thank you so much for your contributions.
So that's a wrap for this episode. Thank you to our sponsor, the International Association for Medical Assistance to Travelers, located on the web at iamat.org. Don't forget to follow Travel Unraveled on Spotify and on Apple Podcasts or on your favorite podcast platform. We'll post fun clips and extra resources on the ISTM website located at learning.istm.org/podcast. We're also on Facebook, LinkedIn, X, and Instagram at _ISTM_. Travel Unraveled is brought to you by the International Society of Travel Medicine. Finally, and thankfully, Travel Unraveled is produced by Ghost Bureau out of Toronto at ghostbureau.com.
Please remember that the information presented in this podcast is intended for educational and informational purposes only. It should not be considered medical advice, nor is it intended to replace consultation with a qualified healthcare professional. The views expressed by the hosts and guests of this podcast are their own and do not necessarily reflect the opinions or policies of the ISTM or any medical or other health professionals, hospitals, clinics, or healthcare facilities. While we strive to provide accurate and up-to-date information, the medical field is constantly evolving, and there may be new findings or developments not included in our content. We encourage our listeners to consult with their healthcare providers for any medical concerns or before starting any new treatment. Neither the ISTM nor any of its affiliates, sponsors, producers, hosts, or guests are liable for any direct, incidental, consequential, indirect, or punitive damages arising out of access to, use of, or inability to use the content of this podcast, or any errors or omissions in the content hereof. By listening to this podcast, you agree not to use this information as a substitute for, nor does it replace professional, medical advice, diagnosis, or treatment. Always consult with your healthcare providers for guidance appropriate to your specific health situation. Thank you for listening to Travel Unraveled. We are committed to sharing knowledge and fostering discussion in the pursuit of better health and well-being.